Welcome to Clean and Comfort. It is July 1st, 2020. It is 7:39 p.m. We have some really good guests today. We're going to be talking about COVID outside of a major medical center and our experiences. Whether it's a nursing home or a doctor's clinic. So today we have Rusty C., we have Joseph P., we have Jeff, Dion, and Liz on board. So we're going to have a very interesting conversation and welcome. Hey, Joseph, welcome to Clean and Comfort.
Hi, how you doing? It's great to be here.
So tell us a little bit about yourself, Joseph.
I'm a diagnostic medical sonographer. I've been doing it for 4 years, loving every bit of it.
So how do you like that?
I think it's great. I'm helping the patient, helping the doctors diagnose the patients and their ailments, and making sure I communicate effectively with the radiologist that's interpreting the images that I provide for them.
So Rusty, tell us little bit about yourself.
Sure. My name is Rusty, and I'm a director at a major medical center in New Jersey, central New Jersey. I've been doing this for over 15 years now, and I love what I do. It's a passion I do to help the people around us. I have several experiences in nursing homes and hospitals as well.
Right. You've been doing what for 15 years?
The EVS, Environmental Services, taking care of the patients, the people around us, the EVS field, facilities field. I'm currently a director, but I was a director at a nursing home as well, the same genre.
Okay, good. So as everyone know, most of us has a lot of EVS experience. Myself, I've been a housekeeper myself. I've been assistant director at a major hospital, and we have tons of experience. So, Joseph, you've worked at an outside type clinic. Tell us about your experiences there during the COVID pandemic.
Yes. So, since COVID started pretty much out of nowhere, what we had to do was become adaptable, and we had to create a protocol to help not just the workers but also our patients, and outside where we had to buy supplies. We had masks, we had gloves, we bought extra cleaning supplies like Clorox wipes, alcohol wipes for our machines, and what we did was like after patient we would take the extra step to wipe down all the hard surfaces and our beds and our machines, and got through the day with the extra patients that were coming in.
And how did the patients feel knowing that you guys were doing all of these extra steps?
It gave them a sense of security that they were taken care of and things are more sterile, things were clean, that there's not going to be any cross-contamination between patients. I've had a few that would ask me, so what are you doing to reduce the spread of the virus? And I would tell them our protocol, and they would appreciate the transparency between the staff workers and the patients to let them know that we do care about them and that everything is going to be okay.
Did you have any training with cleaning or any type of extra tips anyone gave you with cleaning?
It's interesting that you mentioned that because I used to be a housekeeper for 5 years, and I've incorporated the skills I've learned as a housekeeper into my practice. And even my colleagues, they would ask me questions as to why I'm cleaning and how I'm cleaning it, and I would teach them. Because back as a housekeeper, I would do high dusting all the way down to the floors, work my way to the bottom, and they would say, "Wow, that's amazing. Where'd you learn how to do all that?" And I said, "Well, I used to be a housekeeper. You learn a thing or two." and they appreciate that. And yeah, yeah, they see
Interesting,
it work.
interesting.
Yes.
So, Rusty, tell us about your institution.
Yeah, no. So COVID came, like everybody says, COVID came out of nowhere. We were, as we saw our surrounding neighbors getting affected by it, we were, as the genuine, New Jersey strong, we were like, that's not going to happen to us, and maybe a little bit ill prepared, but when it hit us and it hits fast, you know, I guess our experience as a team and that together and to the forefront, but it hit us hard, and thank God for the experience that we learned over the years with Ebola and other major diseases into effect, and we band together and all the proper hand hygiene was important in trying to keep this major disease down. And that was to the forefront. And at EVS, I mean, we came out as like the real heroes. Not that the nursing are not the heroes and the medical staff, but we are the unsung heroes. We stepped up to the plate. We were first responders to the disease, and we worked our way to get for the cleanliness to keep people healthy, keeping visitors healthy, and then keeping the staff healthy, which so they could do their job. So nursing and doctors can take care of the patients. We had to do our job in sanitizing every ounce, every inch of the hospital.
Now you mentioned that, I remember Liz and I in a previous podcast talked about keeping our staff healthy and making sure. I think Jeff mentioned that we have to make sure that our staff are mentally healthy, so they'll be able to come into work and produce. Because if they're not healthy mentally and physically, then we don't have anyone. Did you lose anyone in this journey?
Dion, what's so crazy about this whole situation is we have 229 employees in our building. We lost about 40% of the staff to emotional,
Wow.
mental, or physical, illnesses. Like, not only that was a debilitating disease that hit people's homes and their families, but mentally, emotionally, it affected us even more. People were resigning because they were scared. Maybe it wasn't the education, but we even after the huge education we did, it hit us so hard. Staffing levels changed, and we still had to try to do what we could with less. It was unfortunate, but we really got hit hard at the forefront, especially when when it became uncontrollable, and we weren't really prepared for it.
Right,
So, Rusty,
right.
quick question. This is Liz. You said 40%. Is that just 40% within your environmental services department?
Yes, 40% just in the EVS staff. I'm not talking
Wow.
about and this is no lie. We had nurses, doctors, EVS staff, transporters who were so scared of what was happening, refused to, take part of or even being close to patients because they were so scared to bring it to their families. And we understood that as human beings. You had to make a choice of being that hero or being a hero to protect your family. But it hit us real hard, and just 40% of our staff alone we lost in terms of like LOAs, FMLAs, people who just got up and said, "This is not for me,"
Wow.
and we didn't know that this was going to be the picture. You prepare for these big things. You prepare for the Ebola virus. You prepare for fires, but to prepare for such a debilitating disease, it was unprecedented.
I
Wow.
remember going on vacation. I was telling Liz one day. I went on vacation and I was told we had one case. I came back from vacation and their entire ICUs are full to capacity. 1 week from one case to maybe 80, 90 cases. Those are the ICU beds. And then it spread from there on in. So Joseph, at your clinic, did you guys close or anything like that due to COVID?
No, the organization where I work now, so I have the same experience. I was supposed to go on a cruise. I was on vacation, and that was canceled. So I stayed home, and we only had one case. And actually, we had five. And then when I came back, the entire place and the ICUs and the ED, I'm working the ED as the front lines, and I do a little bit of inpatients, and everyone was infected, and it was hard. It was scary, to be honest with you. It looked like something from a sci-fi movie, and I had to grow thick skin, and I bared it, and it was hard. It was heartbreaking. Um, Seeing people with blood clots, seeing people with damaged lungs, kidney failure, everything. It was hard, but I had to do it, not just for them, but also myself to learn and understanding that everything's going to be okay. And I had the PPE, and I know since I have a background in EVS, I knew how to clean, I knew how to protect myself from being infected. You
That's a
know.
really great perspective that you shared. Thank you for that. Really, um, that's really great. I have a question for Rusty. Um, Rusty, how did you, with 40% reduction in staff, give or take? Two questions actually. When did your team start preparing and realize this is going to impact us more than anyone had ever anticipated or could have imagined? And then the second part of my question is, what did you do? What kind of action did you take as a leader to help your team out?
Wow, that's a really good question. To tell you that we were prepared for the situation, I would be lying. I was one of those guys who probably sat on my TV, was like, well, that will never be us. And we were nonchalant. We were still taking care of C. diff, Canada R's. We do our thing in our EVS, but when it hit us, it was like we questioned a little bit about what we do. We had a big meeting and we said, listen, are we prepared for this? Can we get this right? But the people who stuck by us, do what we've learned over the years, and what we've learned in the past really, really hit home. PPE is important. With our PPE, we're superhuman. There's nothing that can stop us if we do the right thing. And wearing your gloves, wearing your mask, N95s, and preparing that way, and still using the same cleaning techniques that we've learned from the beginning, helped us get to where we are. And people felt comfortable as soon as they found out that this, with the PPE on, and you do what we've practiced over the years, and we keep instilling that. We had morning meetings, morning huddles, weekly meetings, still with our mask on. We use web access to kind of like do these morning meetings with that, so we don't have all our teams together. That was great. One thing we did do that I was really glad that we did is that we introduced ultraviolet UVC light to assist us in disinfecting PPE that we we didn't invent, but we kind of took it from one of the university hospitals in the West Coast and started disinfecting our N95 masks to give us a longevity on our PPE when nobody had PPE. That gave everybody a sense of security. The doctors and nurses. I mean, we band together as a group around the EVS team to entrust us that we were going to disinfect your PPE the right way so they can treat the patients. That in itself brought a whole different aspect to what we do in the game of EVS, of not only just cleaning, but even cleaning the PPE that the people use to protect themselves against the disease. I think education helped a lot. Constant conversations, pep talks, motivational talk, and telling people it's going to be okay, and then giving each other some mental time. I think that helped us a lot.
Question: How did you put everything in a room, or how did you do it?
We used
Disinfect the N95.
Yeah, we used a study that was done in one of the university hospitals on the West Coast, where they used UVC light in a room, a clean, sterile room, where we hung basically like clotheslines in a room and gave enough space between the UVC light and the N95 mask. And they were only using a certain type of mask because that was the only type of mask that was in the study. We hung them up in a room, clotheslines, disinfected the mask with this UVC light about 15 minutes. And they smell like popcorn, but that was a smell of clean. We labeled it as a smell of clean. But we would bag them into sterile bags